Welcome back. This is Dr. Kaan of the ACL Academy. Today I'm going to touch on the time commitment of the ACL rehab process, especially for those who are looking to get back to some sort of sport or activity. Before I get further into that, guys, if you've been following the channel, found some value here, please subscribe to it. Please, if you have questions, comments, drop them below. We get to basically every single one. And more importantly, share with a fellow ACLer that could benefit from these videos. We put out new content on a weekly basis. So today, really important topic. What I want people to understand is, especially if you're going for surgery is the first step of 1,000. Yes, it's going to replace your ACL, and it's going to make it sound again. But there's an uphill climb after that, especially for those of us looking to have a physical and active lifestyle. So one thing, especially for those of you who just got injured or Googling, searching, and are on YouTube looking for tips and advice on what to do, what's the next course of action, having surgery, who the best surgeons are, and if you're seriously considering going down this route of a surgical intervention, getting that ACL reconstructed, it is important that you understand that there is a time commitment after, and it can take up to a year, and for some even longer, for you to feel confident and strong again. So it's important that you evaluate the time that you have now and try to look 3 months, 6 months, 9 months, a year down the road, and just get an idea, well, will I have the time, the mental bandwidth, the physical bandwidth to put in the work required? Otherwise, I'm going to be the first person to tell you this right now. You will be very, very disappointed, because if you cannot commit to the rehab process, if you cannot commit to the length of the rehab process, if you cannot commit to the time and effort and the work required in order to have a successful recovery and get back to your lifestyle, you do not need to sign up for surgery at this time. There are conservative ways to rehab and to get back basically a pretty good life, if not a very active life. But if you are looking to, let's say, get back to a specific sport, and it's a high volume, it's a very demanding type of sport, and you feel like surgery is the best option for you after reviewing your case with your surgeons and your rehab team, yes, that's fine. I want you to understand, because most surgeons won't tell you this, that is a time commitment and a lot of work required to get back to the sports and activities that you love. You'll hear surgeons talk about, well, in a couple months you'll be walking, and in 3 months you'll be lifting again, in 6 months you'll feel good as new. It's just not the case. That is absolutely not the case. Everybody responds a little differently after surgery. Every surgery is different, and even how you respond, your muscles respond, will be different. Some people will recover a little quicker with some of the baseline foundational stuff, getting their motion back, getting their strength back. Still, there's two parts to this process. One is that the new ACL that they put in has to turn from the structure that it is into a ligament, and that takes time. And the other part of the process is physical milestones. So that means getting swelling down, getting motion back, getting strong again, getting both legs strong again, not only side to side comparatively, but also getting strong against your body weight. So these are the things that we do focus on. So what I wanted to touch a little bit on today before I went into a tangent was the time commitment required. And I want people to understand, give or take, what it will be. So after surgery, I will tell you this is a 7-day process. You will need to be doing something for your knee every single day, and it really starts day one after surgery. Yes, you're going to be in pain, and that pain can linger, especially from the surgery itself, anywhere from 7 to 14 days. But it's important that we start getting your knee moving. It's important that you have a regimented program. It's important that you have structure right off the bat. If we can get you to start right away, it gets you in a groove, not just physically, but also from a mental standpoint. So I will tell you, it's a 7-day process. And give or take, in the beginning, we're really, really honing in on range of motion work. Right? We want your full straightening, your extension back. And then little by little, we want to gain your flexion over that first month, 6 weeks. So that stuff requires volume. That stuff requires a lot of consistency, which means every single day you're moving the knee, sometimes multiple times a day. just so people get an understanding of that range of motion work can take anywhere from 20 to 30 minutes per day. And that is hands down not even an option. That is a must, especially if you want your motion back quickly. You don't want to be struggling weeks, months out trying to gain motion back. It needs to start day one after surgery. It needs to start regimented and structured. I will tell you it requires about a half hour every single day. And some of you may say, well, I'm going to therapy twice a week, or I'm even going to therapy 3 times a week. It doesn't matter. That's not enough. You need to be doing stuff on your own. It's great that you have therapists or a physio that's going to arrange your knee and it's going to move it and stretch it. In order to see true gains, you need to be doing stuff every day, and that's you moving your knee actively. So that's every day, flexion, extension work, and that's about 20 to 30 minutes per day. Now, on the other side of it, now as you're getting your motion back and it's looking good, we're just working on strength as well. So that's the next addition to that. And for strength work, I will tell you, usually in the beginning, we're doing something every other day, basically specifically targeting the quads and the other big muscle groups around the knee. These workouts may be anywhere from 45 minutes to an hour long. And as your motion is coming around and everyday activities are looking okay, meaning you're walking, you're negotiating stairs okay, you're in and out of your car, you're driving, and you're prepping for the gym. Once we can get you in the gym, your strength workouts will be anywhere from 3 to 4 times a week. Again, about 45 minutes to an hour. So what I expect people to get in the gym around 2 months, 2 to 3 months is the ideal goal. Everybody will be on their own unique path. Really, requirements for me to get you into the gym is I want swelling to be basically minimal. I basically want 90% of your range of motion back in your knee. I want you to be doing everyday stuff okay. So walking and stairs should be fairly decent. Once you transition to a gym program, like I said, 3 to 4 days a week, 45 to 60 minutes, these will be tough workouts. We'll be starting to load the legs. So the recovery days are important. You cannot work out every single day because there won't be enough time for the recovery process to take place as well. So when we get you into that gym mode, as I said, could be anywhere from month 2 or 3. We're still working on some mobility work. So now you're looking at a time commitment that could be 15, 20 minutes every day with mobility work, and then 3 to 4 days of gym work. This will continue until we can reach a certain strength score. We do strength testing starting at 3 months, right? And then you do a test every month thereafter. Once we can get you to 80% scores, we add some running. So you're going to add in a running progression in that routine. So a little bit of mobility, strength work, and then a running progression, which would be anywhere from 1 to 2 times a week. Once we get to 90% strength scores, well, that's when plyometrics, jumping, some hopping, and then some agility start, right? So as we're starting to transition to a return to sport phase, so we're going to add that in as well. So now you're looking at still maybe doing some daily mobility work, could be down to like 10 minutes a day, right? You want to make sure the knee is moving and it's fluid. Maybe any other parts of the body above and below are a little stiff. So I will still incorporate that stuff daily. We may reduce strength to twice a week and then add in your plyometric agility program twice a week. So now you're looking at 4 workouts, anywhere from 45 minutes to an hour long. So this can transition, and now we're talking into month 5, 6, 7, 8, 9, right? So you are in the deeper part of the rehab process, but it's never really changed the load from day 0 to month 9, 10, even 11. You're still doing daily mobility work. Your strength routine is fluctuating a little bit. But you're still getting about 3 to 4 sessions in focused on your legs per week. These sessions are anywhere from 45 to 60 minutes. And that commitment stays, especially if you have a targeted return. Let's say if you want to get back to a sport in a year and you have this goal in mind, and you have this vision in place, it's important that you follow this structure. And the biggest issue is people that are starting or signing up for surgery, a lot of them don't know the requirement because either they weren't educated the right way or the surgeons didn't tell them that these the requirements would be, and they asked their old teammate or maybe their father or parent had that surgery years ago, and they told them this is the commitment. It doesn't work like that anymore. This rehab process really takes close to a year. And I will say it is basically a 7-day process. It requires a little bit each day, and on some days a little bit more. A couple things that I'm going to share with you that will help. Okay, get yourself a good rehab team. A team that knows the ACL surgery, that knows the ACL rehab process, that kind of can both show you what the rehab will look like on a large scale, and then also show you week to week, day to day, what it should look like. You guys can map out a program together. This is going to be important because every program can fluctuate. One, depends on how you look and what's required. So there's always going to be a best recommendation. But number two, some of you are in school. Some of you are working full time. So these are the things that will be tailored to you. Based on your progress, what I tell my clients is, here's how you look. Here's what we'd like to do. Now let's look at your life and what can you commit to. Once you could tell me what you commit to, then we could plan accordingly around that. But the quicker we can give you some structure, the quicker that we can get you to routine and have you start that consistency, build some momentum, this is what's going to lead to success. Because it really takes a few weeks for you to get kind of into a good rhythm. Once you do that, usually people have it set in stone. Once they have a schedule, once they have some structure, they have a routine down, things go a little bit smoother. That's the biggest thing. You get yourself an ACL rehab provider that can help you map out your recovery process and then give you structure. Now, this is also important that if you're going to physical therapy, and whether it's twice a week, 3 times a week, you have to make sure that when the days that you're not with your physical therapist, your physio, that you have that solid routine to follow, because that's what's going to not only carry over everything you're doing in PT, but also help accelerate the process for you as well. There will be highs and lows in this process. You will get pain sometimes. Maybe some swelling will occur. You'll have some issues, some setbacks. When we have a routine, this is what's going to help. So there's 2 things that I will tell you that helps the most. One is I just touched on, the routine, having the structure, making sure that you know what you should do every day and there's no guesswork. Number 2, you need a vision. Okay, so what did you have surgery in the first place for? What's that specific sport? What's that activity? What's that emotion that you're looking for, right? That's going to be the driving force for you, whether it is a particular sport or maybe it's just being active with my kids again. You have to be hanging on to something. You have to revisit that vision every single day. Lastly, another thing to keep us motivated and involved is we have to recognize small wins every day. There are some days where you're going to feel like we're a loss. There are some days where you're going to feel like we're great. Maybe you missed a workout. It's okay. We still need to recognize a few small wins each day, because that's going to help us carry over into the next day, give us some energy and motivation for the next day. So just wanted to touch a little bit on that. I hope you guys get a good understanding now. I get this question a lot from my own clients and from prospective clients and people that we talk to on Instagram or here on YouTube, as well as Facebook. Well, just not understanding the process and how long it takes. So if this is you and you just got injured and you're thinking about surgery, I want you to know surgery is the first step of 1,000. And this rehab process requires 7 days a week, a little something each and every day for that knee. And it could take up to a year or longer to really feel 100% confident and back to the sports and activities that you love. As if you found some value here, subscribe, give us a like. If you have some questions, comments, drop them below. We'll get to each one of those. And more importantly, if you have a fellow ACLer, please share this with them as we put out tips and education on this channel weekly. I look forward to seeing you guys next time. This is Dr. Kaan signing off.